Rapid testing is one of the options for testing for the antibodies of HIV or the HIV virus. It is newish to our region. It is a situation where persons who's desirous of getting tested for HIV does not have to wait a day or two to get the results, and the results can be available to them within an hour or two of actually getting the test, and that's why it's called rapid testing. The reason rapid testing is important is because, first of all, as a region, we're trying to increase the amount of testing that we do, and nationally we're trying to increase the testing that we do as well, so that most of the people who are HIV positive will know their status. As a matter of fact, the new UN goal is that we have a 90-90-90. First 90 means that 90% of the persons who are HIV positive are tested and actually know what their status is. And this is for this reason that rapid testing has gained prominence, because we recognize that there are persons who, if you meet them and counsel them about getting HIV test, and you ask them to come back another day to get the test, or you ask them to go somewhere else to get the test, invariably you might lose some of those persons and they may not be able to be tested if they HIV. So rapid testing provides an opportunity where, as soon as someone is reached and you make access and make contact with someone and speak to them, if they desire a HIV test, it can become available to them right away. We are piloting a program to improve rapid testing at some sites that are remote from the hospital. As it is now, the major labs are the ones that are doing testing: the General Hospital, the other La Spice Imaging, or St. Augustine's. But it requires a person to access a healthcare provider who would order the test, and then the test is taken to the lab and the lab comes back. And as I said, this has proven not to be effective in getting all the people we really want to get. So the idea is, what if we try to decentralize the testing sites and have other places do testing? So to do so, we've decided to pilot testing at 3 separate sites, apart from the sites that we already know. And more importantly, we want to test at sites that are comfortable for other people to go, especially persons in the key population. So we've decided to partner with one of our civil society organizations. We're going to partner with Grenada. We're going to also partner with Planned Parenthood Association, and even at our own NIDCU, we really want to be able to do testing right there when patients go to access care there. That's what the pilot is all about. At the moment, we are doing a couple of things to ensure that the pilot is rolled out well. The first is to train persons to be able to do the test. We've done that by sending some of our persons to become trainers, and they themselves can come on the island and train other testers on the island. The trainer of trainees have already commenced and finished. We have completed one training on island, training local persons, healthcare providers, as well as persons from civil society organizations to be able to conduct tests.
The workshop is to really get to the most at-risk population. And when we talk about the most at-risk population, we talk about persons who are highly at risk. For example, pregnant women, men who have sex with men, commercial sex workers, LGBTs, transgenders, and the list can go on. So because we think that these people are at risk and they are most vulnerable, and they may not want to access the facility, the private and even public facility, because of stigma and discrimination, I think that the workshop is really timely. I firmly believe that people are people and must be treated as such. And these people really need to access, or they really need to be taken care of altogether, because they have the same rights as everybody else.
As far as the availability to the general public, I would say as soon as the program is rolled out, although we're rolling out specifically for rolling out targeting key population, it is available to the general public anyway. GPPA, for example, while they are open and able to provide services on testing for key populations, if the general population wants to access care, fine. At NIDCU is the same thing. If the general population wants to access care, that's fine. As a matter of fact, I think the general population are better able to access that kind of care, because people are fearful of HIV, and so they themselves being able to access care at the same time and get results at the same time, I see no reason why they wouldn't want this as well. So I think everybody is going to benefit from it once we start rolling it out.